121 Dental Hygiene Preclinic Lab Test for Post-Treatment Operatory Disinfection. You have just completed treatment on a patient. Demonstrate operatory cleaning and disinfection. Don gown, mask, and face shield or glasses. Wash hands and don treatment gloves.
I'm already wearing my prescription glasses, so I'm going to don my mask. Then my glasses. I'm going to wash or hand sanitize my hands. Treatment gloves.
Then don nitrils. Remember, nitrils should be disinfected from the previous patient.
So these have been disinfected from the night before.
Open lower cabinet door under sink and retrieve instrument transport box. Open box and place on counter. Remove 7 disinfectant towelettes and place in groups of 2, 2, 1, 1, and 1 on the chase. They may overlap, but you should be able to pick up one group of towelettes without contaminating the other groups. Use paper towel to push in writing desk. Use a paper towel as a barrier to remove plastic covers from computer keyboard and mouse.
I'm going to remove the wax paper. Remove the plastic. And if you contaminate and need to get another paper towel, you can do that.
Use a paper towel to push in the writing desk. Discard paper towel. Move clean keyboard to top drawer and mouse to charger or into drawer if it's battery operated.
If your mouse is battery operated, you want to make sure you turn the mouse off before putting it in the drawer.
With clean nitrils, remove unit bottle of water.
I'm going to turn off my unit.
Empty water into the sink and then replace water bottle on chair unit.
I'm going to switch my unit back on.
Remove name tag and place on countertop. Remember, nitrils should still be disinfected at this point. Once name tag is touched, nitrils become dirty. Express both air-water syringes on the unit, operator and assistant side, into a cup or into the sink.
So we're going to bleed the line. We're just going to hold the water down until only air comes out.
Purge supplemental equipment, ultrasonic, ProfiJet, etc., if used, into a cup or the sink until all water is drained. Lines should not have water left in them.
I'm going to remove the tip. I'm going to go ahead and place it in my box. This has to be done with the sheath on the ultrasonic. You want to make sure that the water is all the way up, as far open as it will go. Put your foot on the pedal. You're going to drain the water until no more water comes out. This may take a minute or so. Okay.
Remove bioburden, blood, plaque, or calculus with a gauze carefully from instruments.
So as you're working on your patients, as you're scaling them, you will be removing bioburden from the instruments as you're working. But if you forget or you finish up and forget to wipe that last little bit, at this stage you're very carefully going to take a gauze and wipe off just the big chunks of bioburden, and that could be blood, it could be calculus, it could be plaque, it could be glue, it could be sealant material, it could be a number of things. But you want to make sure that your instruments have the largest pieces of bioburden removed.
Place instruments, handpiece, and ultrasonic tips in transport box and take to sterilization room.
I'm going to make sure I have all my instruments secure in my cassette. It's going to go in the transport box. I've already taken my ultrasonic tip. I'm going to take my handpiece. I'm also going to make sure that I take the ultrasonic sheath at this point. Place it in the box. And anything else that I may have collected in my operatory that would need to go back to sterilization.
Take box to sterilization room. Place all on dirty side counter for sterilization person. Bring box back to operatory and place on counter along with other dirty items for disinfection.
So I've delivered all my instruments to sterilization. I'm bringing my dirty box back so it can be disinfected.
Place the patient mirror, patient safety glasses, napkin chain, and any other items that are contaminated in one area of the counter with name tag. Pens and pencils will go into this pile if contaminated.
So everything that I've used for my patient is going to go in this area here.
Remove all barriers and disposables. The air water syringe, light handles, saliva ejector, high-speed suction, pens, pencils, operator chair adjustment levers, and place in patient chair bag.
So all barriers. And all disposables. You want to make sure if you have used sticky barriers on any surface that you fold down both sides so that when you get ready to take these off, it's easier to take those off.
Carefully remove barrier bag from bracket tray and place into patient chair barrier. Carefully remove barrier bag from supplemental equipment or assistant side and place in patient chair barrier. Without contaminating patient chair, roll up chair barrier with contaminated barriers and disposables and place in bay trash container. Clean by removing bioburden. Using 2 towelettes, 1 in each utility gloved hand, wipe the chair arms, top, and bottom. Always keep a towelette between the nitrile glove and the item being cleaned.
So I'm going to use 1 on top, 1 on bottom.
Pull out and wipe writing surface. Thoroughly wipe the soap dispenser bar and the dental light protective cover.
It's very difficult with these nitriles on to have a good grip, so hang on.
Using a wipe in each hand, pick up and clean the items on top of the counter.
So I'm going to start at the far end of the counter. I'm going to scooch everything down and make a clean area. So that I can start wiping and placing.
Using a wipe in each hand, pick up and clean the items on top of the counter, including the instrument box and lid. Place the newly cleaned items on a newly cleaned area of the counter.
So I'm going to make sure I place this back in the clean area. Continue wiping the countertop.
Also, wipe any other items you may have inadvertently contaminated during treatment. Example, drawer handle or unit arms. Wipe all items that have sleeve barriers. Example, air, water syringe, housing, and hose.
So even though these have had barriers on them, at times they can become contaminated. So we are going to wipe the syringe, housing, and the hose.
Handpiece, housing, and hose. Saliva, ejector, housing, and hose. As well as the high-speed suction, housing, and hose. Ultrasonic hose and shelf.
And if you touch the ultrasonic in any way, you want to make sure you disinfect that. At this point, we're actually doing the cleaning portion. You want to turn off the ultrasonic.
The light handles and switch.
And I do notice that students inadvertently touch these little areas right here. switch,
the operator chair adjustment levers, and any other part of the chair you may have touched.
occasionally I see students touching the chair, the back of the chair, pushing the chair around. So you always want to make sure you wipe that if you contaminated it or thought you contaminated it.
Wipe anything else you may have inadvertently touched with dirty nitrils. Discard these wipes. Then wash the nitrile gloves with soap for 15 seconds.
So remember, we're always going to wash our nitriles the same way we learned to wash our hands.
Dry with paper towels.
And remember, the reason we're going to dry our gloves before we disinfect them is so we don't dilute the solution.
While still wearing the utility gloves, disinfect thoroughly with a single towelette. These must remain wet for 3 minutes before continuing with the disinfection process.
So we have cleaned our nitrile gloves with soap and water. Now we're going to disinfect our nitrile gloves. So you will be continuing wiping our nitrile gloves, the nitrile gloves, for 3 minutes for them to be truly disinfected. And the reason we're doing this is so that we can be, when we start the disinfection process on our operatory, our gloves start out disinfected also. Three minutes is a very long time. So you can count in your head if you like.
When the 3 minutes is up, the cleaning portion is concluded.
Almost. Okay.
Okay. Now we begin disinfection. Using 2 towelettes, one in each hand, wipe the items you previously cleaned in the steps before. That includes armchairs, chair arms, soap dispenser, and dental light cover.
Okay.
All the items on counter, place the newly disinfected items into the disinfectant portion of the counter.
Okay, kind of scooch everything down again. clean myself a good place.
Okay.
Gonna move on with the rest of my counter.
The air water syringe, housing and hose. The handpiece, housing and hose. Light handles and switch. Saliva ejector and hose. The high-speed suction, housing and hose.
You may or may not be using the high-speed suction at every appointment.
The saliva ejector, housing and hose. The high-speed suction, housing and hose.
You may not be using the high-speed suction on every appointment, but it's so very close to everything else. We should probably go ahead and wipe that.
And the ultrasonic unit and shelf and hoses. Wipe operator chair adjustment levers. And anything else you may have contaminated. Only you know what you touched. These items must remain moist for 3 minutes, or however long the manufacturer instructions require. Discard towelettes. Remove operator overglasses. Wash with soap and water, and then dry with paper towel.
If you are using loops at this point, you would complete your task and then clean your loops according to your manufacturer's instructions.
Disinfect glasses with last towelette. Discard towelette. Wash the nitrile gloves with soap and water for 16 seconds using the same procedure as hand washing. Dry gloves with paper towel. While still wearing the utility gloves, disinfect thoroughly with a single towelette. Dry gloves with paper towels. While still wearing the utility gloves, disinfect thoroughly with a single towelette. Hang over sink to dry.
Remember, I'm going to do the nitrile glove shimmy.
With treatment glove hands, open the trash door. Push up the trash ring holder and hold with one hand while pulling the trash bag down with the other hand. Let the trash ring drop back into place. Remove the trash bag, tie in a knot. Compress the air out of the bag before placing it in the large yellow trash receptacle near the locker room.
Normally, this would be, this is actually, the yellow trash can is housed next to the ladies' restroom across from the water fountain. But just for filming purposes, we've moved it here into our clinic so I can demonstrate what you're going to need to do. So we're going to throw our trash in the trash can.
Remove your treatment gloves and put in the can.
And remember how we learned how to remove our treatment gloves without contaminating ourselves?
Touching only ear loops or back band, grab mask and remove with one finger.
So I'm just going to take one finger, remove my mask.
Throw in yellow trash can, holding from back only. Remove gown. turning it inside out as you go, and deposit in yellow trash can.
I'm going to grab it from the back, turn it inside out, and throw that away.
Use antiseptic hand rub on the way back to your operatory.
On the way back to the operatory, I would have some antiseptic hand rub. I'm ready to begin getting my operatory ready for the end of the day.
Return writing surface to cabinet. Remove water bottle and place on counter upside down on a paper towel to drain.
I needed to turn off my unit for that.
Replace all disposable items. If you use sticky tape as a barrier, please fold down each side slightly for easier remover.
Then I'm going to place my chair barrier. Bracket tray cover.
If using sticky tape as a barrier, fold down each side for slightly easier removal. The light handles may also be covered with sandwich bags or aluminum foil.
That's your choice, really, which barrier you would like to use on the light handles. If you use sticky tape, you do want to make sure you pull turn the edges down.
Cover bracket tray.
Covered bracket tray.
You cover, okay. And then cover operator chair handles. Raise the dental chair.
So when you turn your unit back on to raise the dental chair, because your water bottle is not on, it's going to make a loud noise.
Position the bracket tray over the chair seat and position dental light over the bracket tray. Using your foot or barrier if using your hands, push the hemostats to the onto the base of the dental chair. Place operator chair under the towel dispenser. Turn off dental unit switch, okay, and replace the trash bag.
Just want to make sure you tuck that in, and then it'll drop back in.
Now you would clean your loops with wet microfiber cloth or cotton according to manufacturer directions. Place on disinfected counter or back on your face if they are prescription eyewear.
Also, at this time, you could put away your items on the counter. It should have been 3 minutes. They would have been disinfected.